Every 3 minutes, a child is born with a cleft lip and or palate. Here in the Philippines, 1 in every 1,000 babies are born with the condition. A cleft lip and cleft palate happen when a part of the lip or the upper part of the mouth doesn't form properly during pregnancy. And as a result, the child has openings or splits in the upper lip, the roof of the mouth or the palate, or even both. These are 2 of the more common birth defects. It's upsetting for any parent to have a baby born with a cleft, but it can be corrected. While cleft lip and cleft palates are not totally preventable, there are steps that a mother can take before and during pregnancy to lower the risk. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk here on CNN Philippines. Even during pregnancy, doctors are able to diagnose if your unborn child has a cleft lip and or a cleft palate, which are also known as orofacial clefts. Joining us is Dr. Bricio Alcantara. He's a plastic, reconstructive, and aesthetic surgeon from the Mabuhay Deseret Foundation. Also with us is Ms. Veronica Yu. She's a speech-language pathologist from the Philippine Association of Speech Pathologists and Smile Train Philippines. First, though, we want to talk about the difference between a cleft lip and a cleft palate. Dr. BG, let's start first with what exactly are these clefts? How are these formed?
During fetal development, which is the embryogenesis, organogenesis starts from the 4th week, okay, during the first trimester. So anything that would happen during the first trimester, whether it be secondary to your diet or any infectious or anything that would hamper the development, you can easily form any type of deformities in any organ system. The lips should form between the 4th to 6th weeks of pregnancy, while the palate will form on the 6th to the 8th week of pregnancy. So anything that would happen between that time, before the 4th week or within the 4th week, there might be a deformity that the upper lip might not fuse or form together to be a normal lip, or the palate may not fuse or form together to be a normal palate.
So kapag ang isang bata ay may cleft palate, there could be a connection between that of the roof of the mouth and the nose. How does this influence the speech ng isang bata?
Patients with cleft palate would usually have problems in speech. So first evident effect of cleft palate is what we call the resonance problem, which is hypernasality, wherein most of the sounds or most of the air would be coming out from the nose. Also, since there's an opening doon sa wall that divides the oral cavity, the mouth, and the nose area, so the tendency is that even if the air is supposed to come out of the mouth, it would always come out of the nose, causing distortion in speech, such as nasal air emissions.
So how does a mother go about the challenges of, let's say, feeding a baby who has a cleft lip and palate?
For the cleft lip, what is important there, the function would be your oral competence. Ay sinasabi nila na if you're gonna feed something, whether liquid or food will not roll out. Hindi lalabas ang pagkain. So you need to treat that so that the competence will be there. Now, in regards to the cleft palate, what is important there is the speech, sabi ni Ma'am Veronica. Kaya na importante. Now, in regards to feeding, they have special nipples. Kasi sometimes the baby, if the cleft lip is not severe, okay, even if he has a cleft palate, they can feed through the breast na naman eh.
Speaking and hearing problems can also be a problem. So hearing problems and chronic ear infections are common for those with cleft palates especially. Now, Ma'am Veronica, why do these happen? Bakit nagkakaroon ng ear problems din ang mga batang may cleft palate?
Anatomically, we have this tube that connects the ear and the throat area or the mouth area, and we call it the Eustachian tube. So since there's a tube connecting both the structures, the ear and the oral part of the mouth, So the tendency is that if mas expose sa infection yung bata because of the opening of the mouth caused by a cleft lip or cleft palate, there's a big chance that that infection would go through the ear area, thus causing middle ear infections.
Now, children with a cleft lip or cleft palate may also have trouble speaking. Katulad ng sinasabi natin kanina, their voices can take on a very nasal type of sound. Sometimes it's hard to understand them. Ma'am Veronica, let's explain this particular situation and how does this develop? Kaagad-agad ba to? Kapag nagsasalita yung bata, mapapansin na ba ito?
One of the most evident effects of cleft, specifically cleft of the palate in children, is their problems in speech. So there's this misconception that after the structure has been repaired, automatically the speech will follow or the speech will improve or will be typical. So this is not always the case because even when the structure has been repaired, the patient will still continue to do their wrong production of the speech sound or what we call the compensatory errors. And a more common type of compensatory error is what we call the glottal stop, or in Filipino, ito yung impit. So the child or the patient will continuously produce the sound at the throat area instead of letting the air come out of the mouth. Another speech concern present in patients with cleft palate is the presence of nasal air emission. So like what I've mentioned earlier, because they've been used to that part at the roof of the mouth to be open. So even if naisarado na po natin, they'd still continue to do that production and the air comes out of the nose instead of coming out of the mouth during production of oral sound.
Later in the show, we'll talk about the different types of surgery to correct this problem and how soon can a newborn undergo any procedure. More after a short break. You're watching MedTalk Health Talk, where your health always comes first. So stay with us here on CNN Philippines. Welcome back to MedTalk Health Talk, where your health comes first. I'm Dr. Freddy Gomez. Now, in most cases, it's really difficult to know the definitive cause of a cleft lip and or palate, but experts believe that it can be genetic or inherited. Environmental problems can also contribute to this problem as well. Here in the Philippines, 1 in 1,000 babies are born with a cleft lip or palate. For the most part, cleft lips happen unilaterally or to one side, but it can also happen to two sides of the mouth. Could you discuss this a little bit more, Dr. BG?
The incidence of the cleft lip and palate actually in a normal population is 0.4%. Even without genetic factors, even without those risk factors involved, may 0.4% pa rin na can be unexplained na sasabihin. In regards to laterality, kung anong side ang mas common, the left is more common than the right than both of them. That would be 6:3:1.
Okay.
So yun ang incidence ng sa cleft lip and palate.
Dr. BG, pag-usapan naman natin kung how soon can a child with a cleft lip undergo surgery? Because syempre, pag nakita ng parent ito, pag panganak, ang unang gusto nila mangyari is i-correct kaagad. But what is the correct time? What is the proper time for this to be treated?
They will tell me if we can operate them at them immediately. Sabi ko, yes, we can in the newborn. As long as the pediatric intensivist, as long as the anesthesiologist will clear the patient for surgery, then pwede. And usually that would be around a week to 2 weeks for the cleft lip. So we can start early because of the new things now that we do, less ang risk na, less ang bleeding. Now for the cleft palate naman, for the speech, you need to address them before the speech will develop or the baby will hear. So pwede kang mag-start from 8 months to 1 year.
Ma'am Veronica, as discussed ni Dr. BG, ideally makorek ang cleft palate para before even the child starts talking. But some of our, of course, some Filipinos have gone through several years in their life with this defect, ano? So nakasanayan na nila ang nasal sound. Can this still be corrected later on in life kapag may edad na yung pasyente?
Actually, that's why after surgery, we recommend that the patient seeks or consults a speech-language pathologist to help them unlearn the compensatory errors or the way that they've been producing the sounds with the unrepaired structure. And aside from unlearning these old habits, we want to teach them to produce the sound accurately and correctly this time since there's no more problem in the structure.
Okay. Now, Dr. BG, pag-usapan naman natin yung actual operation. Matagal bang operation ito? How long is the recovery period?
If it's just incomplete cleft lip, the surgery can only take around 20 to 30 minutes actually. Okay. Recovery time, the baby can go home. Pag lip, we're talking of the cleft lip, the baby
Yes.
can go home the day after the operation. Okay. Pag bilateral, meaning you have two defect here, right and the left side, it may take you around 1 hour to do the operation. Then we usually let them stay in overnight, and if they do not have any problems, like usually nakaka-fever yan afterwards, then we let them stay for a day or two.
Some parents might think na after nyo makorek, tapos na yung mga operations nila. Is it possible to have another operation probably later on down the road?
Normally, yung sa scars that would form afterwards, we tell the parents na pwedeng ulitin yung pagagandahin mo yung scar. So that's revision surgeries. Tapos pagka medyo severe, like a complete unilateral cleft lip, may cleft nose involved yan. Makikita mo yung nose nila deformed din. Tawag namin doon cleft nose. So we tell them we will address the cleft nose when he becomes or she becomes older. So may mga sinasabi namin, it's not a single stage of operation. Pwedeng dalawa, tatlo, or apat. Depende sa makikita rin afterwards.
Now, there are a number of organizations here in our country that provide free surgeries to repair a cleft lip and or palate. And among them are the Mabuhay Deseret Foundation. This group works with the community and local Filipino doctors to facilitate life-changing surgeries, from cleft lips and palates to clubfoot to various eye surgeries as well. You may visit their website at mabuhaydesseretfoundation.org. Or you may also call them on their landline at 912-1681. Mabuhay Deseret Foundation has offices in Manila, Cebu, and Davao. Another group is the Smile Train Foundation, which is the world's largest cleft charity. This group also works hand in hand with Mabuhay Deseret Foundation. Visit their website at smiletrain.ph or call them at 0917-528-7246. When we return, what can you do to help prevent cleft lip and cleft palate in your baby? You're watching MedTalk Health Talk on CNN Philippines. We'll be back after a short break. It's good to have you on the program. MedTalk Health Talk is your partner in health. I'm Dr. Freddy Gomez. Now, there are steps mothers can take to help lower the risk of having a baby with a cleft lip and cleft palate. First is taking folic acid even before their pregnancy. Ma'am Veronica, bakit folic acid? How does folic acid work?
There is still a lot of inconsistent study about the effect of folic acid intake in the formation of babies during pregnancy. So I think one of the reasons why folic acid, because a lot of studies found that some parents or some mothers have limited or to no intake of folic acid during pregnancy, kaya nagkakaroon ng cleft of the lip or cleft of the palate yung babies nila.
Now, there are a number of very important do's and don'ts. Dr. BG, pag-usapan natin yung mga do's and don'ts ng mga pregnant women to minimize that risk of having their child have a cleft lip and or palate.
During the first trimester, it's always critical during the first trimester for any system that would be developing. Ang first thing is, if you have a friend, neighbor, or a relative or inside your house that has an infection, stay away from them, especially if it's a viral infection, like the ordinary colds, the flu, even the chickenpox, the varicella. They are the ones that would increase the risk. So one is infection, always in the first trimester. Next is exposure to radiation. If they work in a health facility, if they're going to need some checkups there, and they're near an X-ray machine or some machines that would have a radiation exposure there, then they have to go out again, or they have to protect them with a lead-lined apron. Okay? Drugs. Another thing is drugs. Do not take unnecessary drugs. Okay? Even tranquilizers. The tranquilizers, the steroids, okay? They're anticonvulsants. They may also increase the risk of the mother having a cleft lip palate baby.
Is it possible to still have a hardly noticeable na nagkaroon ng cleft lip or palate ang pasyente?
Kasi a younger individual, the scar formation there is very negligible. So, if we tell them it's a good scar. So, hardly seen. Tapos, as you grow older, yung scars lumalaki, lumalapad minsan, or tumatambok. So, nahahalata rin. If you look at the upper lip, makikita mo, there are anatomical parts that you need to realign or kailangan didikit nyo ng husto para hindi halata. Okay? Pagka kahit hindi cleft lip, pag may nasugatan nga sa upper lip pag may hindi ka nadikit na maganda dyan na tama, makikita mo kaagad na nagkaroon siya ng sugat doon. So, kagaya you do an anatomical repair kung gusto mo talaga, it's a very pleasing scar.
Ayan. So, kay Ma'am Veronica naman, I'd like to ask, so if the functional part of a cleft palate especially has been addressed, can the speech of the patient be indistinguishable from someone who has not had a cleft palate?
Actually, that's possible. Just at the start of this pandemic, Smile Train launched their telespeech services, and in a span of 2 months, we have around 2 to 3 graduates who was able to exhibit close to normal speech production after series of speech therapy sessions.
And with that, I'd like to thank our guest for today, plastic surgeon Dr. Bricio Alcantara and speech pathologist Ms. Veronica Yu. It was really good speaking to you both. I'm Dr. Freddy Gomez, and we'll see you again next time. Stay safe, everyone.